Let's shift our attention to the global vaccination drive. It's a story of inequity. In the West, there are people refusing to take jabs. Elsewhere in Africa, there aren't medicines, let alone vaccines. All the talk about global cooperation, and this is the end result. A logistical nightmare. This whole pandemic has been a learning curve, really. The lessons learned in the last 12 months should help us prevent the next pandemic. That is, if countries are willing to learn. Right now, this is a world of vaccine haves and have-nots. In the United States, doses are wasting away in refrigerators. In Japan, they don't have enough syringes. What does this say about global cooperation and planning? It's a complete breakdown. On Wednesday, we talked about this, about how multilateral and regional groupings have failed to boost cooperation. Today's SAARC workshop was South Asia's chance to write the record. The virtual meeting was convened by India. Not just SAARC members, but 10 of India's neighbors participated. Prime Minister Narendra Modi addressed this meeting. He talked about promoting best COVID practices and the need for South Asian unity. These were some of the proposals that he laid out.
Can we consider creating a special visa scheme for our doctors and nurses so that they can travel quickly within our region during health emergencies on the request of the receiving country? Can our civil aviation ministries coordinate a regional air ambulance agreement for medical contingencies? Can we create a regional platform for collating, compiling and studying data about the effectiveness of COVID-19 vaccines among our population?
A visa regime for medical workers, a regional air ambulance for health contingencies, and most importantly, sharing vaccine efficiency data. All great proposals. But in this political climate, getting everyone on board will be next to impossible. Politicization of the pandemic is not new. Even vaccine approvals and purchases are political. Venezuela will only use Russia's Sputnik. Iran will let its people die before using American jabs. Pakistan is at the mercy of Chinese doses. Add to this a breakdown in supply chains and we have a full-blown crisis. Sample this. More than 180 million Americans have been inoculated, yet in Africa the jabs have not even arrived. At this rate, it will be 2023 before large parts of this continent are inoculated. Meanwhile, the world's most powerful fighting force is turning out to be anti-vax. Almost 1/3 of American servicemen are refusing to take the jab. Why? There's no clear answer. Some reports say the troops are falling for internet rumors. Either way, it's a dangerous prospect. American troops travel the world. They eat, sleep and train in close quarters. It's a virus cluster waiting to emerge. So the Pentagon leadership is scrambling to find a solution.
We believe that, of course, the vaccine is the right thing to do. It's clearly safe for service members, and we need to continue to educate our force and help them understand the benefits and ensure there's leadership involvement in the discussion of the benefits of the vaccine.
Across the Atlantic, Britain is falling back on some desperate tactics. They have approved a new clinical trial, one that will deliberately expose healthy people to the Wuhan virus. It's a first during this outbreak. Here's how it works. Normally, during a vaccine trial, you're given an experimental jab, but at no point are you infected on purpose. In this case, volunteers are being infected in a controlled environment. A couple of reasons why they do this. One, to understand the minimum virus load needed to trigger the infection, and two, understanding how the virus transmits. 90 volunteers have been roped in, all aged between 18 and 30. They'll all be paid £88 per day, the cost of putting their lives on the line. To be clear, human challenge trials have been done before. They can be helpful in understanding more about a disease, but the fact that the UK is doing this now just goes on to show how dire the situation is. The world would do well to take a leaf from India's playbook: cooperation, solidarity, and neighborhood first. These have been the pillars of India's pandemic response. Had the world worked along similar lines, we would have been having a completely different conversation right now. WION is now available in your country. Download the app now and get all the news on the move.